and welcome to Let's Talk Aging. I'm Gwyneth Johnson, CEO of Second Wind Dreams. We are an organization dedicated to changing the perception of aging. This series, we plan on showcasing other individuals and organizations dedicated to changing that very same perception. Today, we are lucky enough to have with us Dr. Elisabeth Burgess. She is the director of the Georgia State Gerontology Institute, a professor, a published author, and an expert in long-term care and sexuality and intimacy, particularly in older adults. Help me to welcome Dr. Elisabeth Burgess. Well, welcome, Dr. Burgess. I would like to introduce all of you to Dr. Elisabeth Burgess. She is the director of the Gerontology Institute at Georgia State University, a professor, an expert in changing the quality of lives for people in long-term care in a variety of settings, and specializes in sexuality and intimacy, particularly in older adults. Welcome, Dr. Burgess.
Thank you. I'm glad to be here.
We're very glad to have you with us. Let's jump right into our questions and see what happens.
Okay.
What is your favorite thing about working with and for older adults?
I have two perspectives on this. One is the personal, which is I've always liked history, and not the history of wars and politics, but the history of people, the personal history. And there's no more wealth of knowledge about how we've lived our lives than the elders in our community, and their voices don't get listened to as much as they should. And so having an opportunity just to sit down and talk to elders about their experiences is just always a pleasure to me. So that's kind of the personal kind of thing that keeps me going. Professionally, I love the field of studying aging and studying elders because it's so wide open. There's so much we don't know. It's a newer field, so we haven't answered all of the questions, and that's an opportunity to really make a difference with the field and working with other people across different perspectives. So the study of aging from an academic perspective integrates everybody from social workers to physical therapists to policymakers to biologists, and getting those diverse perspectives together to understand the needs of our elders is so intellectually stimulating to me.
Absolutely. And I love what you said about the history. There is no better way to engage someone than to get them to tell their story. There's just something about getting someone to open up like that. And it provides information we would never otherwise hear.
Absolutely. And so often our stories of histories are only told from the winners or the politicians, and to hear the stories of real people from different backgrounds, you can learn all kinds of things about the past. Even if it's talking to your neighbor or talking to your grandparents, you can learn about what life was like in the 1920s, or kind of what the experiences were to be a blue-collar worker in downtown Atlanta in the 1950s. All of those things are pieces of our history that are so important to understand.
Absolutely. Well, what does your organization, the Gerontology Institute, do to make a difference in the lives of elders?
We do a lot, I like to say. So the Gerontology Institute at Georgia State is an academic organization. We have degree programs. We're also a research organization with engaging in a whole bunch of research in different areas around aging. And then we connect people. I like to think of us as the center of a wheel with spokes going out around the country and around the metro area and more around the globe. And so we're connecting people who are interested in the needs of elders. But most directly, as a teacher, I'm introducing students to issues of aging that they may not have even thought about before. So one of the classes I love to teach that I don't get to teach enough is Introduction to Gerontology, which is talking to freshmen and sophomores who may just be taking it because it meets a requirement, and suddenly they're introduced to the diverse experience of elders, and to understand that this is a career opportunity, that this is really, with the changing demographics, we need people who are experts in aging and the needs of elders in every one of these disciplines. And so whether you just take one class or you major in gerontology or you get a master's degree, you can make a difference. And so I feel like a lot of what I do is indirect. I may not be working with elders directly, but I'm teaching somebody who's going to make a big impact. And so through teaching, I really see that as a ripple effect.
Absolutely. And I have had the pleasure of interacting with a great many of your students as interns, as employees, attending their project presentations. And I'm always amazed and come away learning something really cool every time I interact with your students. So thank you for what you're doing. It's critical.
I learn from my students every day. I think the joy of teaching is that we get as much from the students as the students get from us. And one of the benefits about Georgia State is that our students aren't just traditional age students. And so we have people coming back to our programs who are changing their careers in midlife. They may have started off studying children and realized they really would rather study aging, or they took care of an older family member and realized this is a passion, and they come back to school to really get the research and the education to back up what is their passion. And so working with students from all backgrounds and all interests and all ages allows me to constantly be on my toes learning from them.
Well, and you provide a really diverse experience for them. Could you talk a little bit about how you've engaged your students in the grant project that you recently worked on?
Absolutely. So I have one project that I'm working on with Dr. Jennifer Kraft Morgan, and this is funded through civil monetary penalty money. And it's looking at nursing home care in Georgia and improving person-centered. Really, the goal is to improve person-centered care in Georgia. Person-centered care is the idea that we're not just looking at nursing homes as medical institutions, that people who live, the elders who live in our nursing homes are individuals with individual needs and preferences. And so we can't be rigid and regimented in terms of how we organize things. We can't get everybody up at 6 o'clock and give them their bath. That's not going to work for everybody, or feed everybody the same meal all the time. At the same time, you've got to meet the needs of multiple people. You've got to meet the needs of the healthcare requirements, and there's rigorous requirements for health and safety. And so how do you create a person-centered approach? So we're studying that along with a lot of other people across the country and across Georgia. And we've integrated our students into this project. And so they're surveying residents, they're talking to direct care workers. We're right now in the process of doing some interviews with family members who have residents in nursing homes to really understand what are the challenges and what are the barriers to thinking about these issues. And as we all know, this has become even more complicated in the past year and a half as the long-term care industry has been completely disrupted by COVID-19. And so our newest approach is kind of asking those questions around how has the experience of isolation and shutdown influenced how you think about care?
Well, it's a marvelous opportunity for the students too. And as an employer, I'm always grateful for those types of experience because they come out with so much knowledge about the process, about the questions, and the complications that can occur.
Absolutely. I think hands-on experience is so important in education. You have to have the book learning to understand the demographics and to understand the basics. But if you can provide students with experiences, whether it's through research or through internships or through bringing in guest lecturers who are leaders in the community, such as you, who've taught for us and come in and done many guest lectures, it's exposing them to what's really going on. That can help prepare them for jobs and careers and making a difference.
Absolutely. Well, how would you recommend people make a difference in the lives of elders?
I would first, of course, argue you can come back to school. I would be in trouble with my bosses if I didn't say what you should do is come study gerontology at Georgia State. But that's not an option for everybody. I think one of the things that that you can do is pay attention to the elders in your community. Who is your next door neighbor? Who is the woman who lives down the street? Do they have a dog? Do they need help walking their dog? Does somebody need help mowing their lawn or tending their garden? Now that we're getting to the really hot time of the year, do they have adequate heating and cooling in their house? Do they need additional fans? So thinking about the needs of the people around you, and many people may not have needs, but they may be lonely. They may need someone to talk to, particularly after being isolated all this time. And so the talking over the garden fence is something that can really brighten somebody's day. And that is not necessarily a threatening thing. You can do it socially distanced still, and just get to know the people in your community. And then within your own family as well. We can have a lot of differences across generations, but it's amazing how much similarity we have. We're all human beings. We're all facing the same struggles. So that's the first thing, is getting to know people. I think the second thing is there's so many opportunities to volunteer. As you know, it's Second Wind Dreams. There's so many
Absolutely.
opportunities there, but in the metro area, whether it's Meals on Wheels or getting involved with other community organizations, if you're ready to take that next step, all you have to do is make a phone call, look on the web, and find a zillion opportunities.
Wonderful. One last question for you today, because I could talk to you all day. How do you change the perception of aging?
It's such a big question. I think in addition to everything I've already talked about, one of my biggest passions is fighting ageism.
Mm-hmm.
I think it's the ism that is least talked about. And I think one of the biggest problems that's, again, something that's raged its ugly head in the past year and a half of the pandemic. We've seen more and more dismissing older adults. And I think this is a personal passion for me, and I have to fight it with my colleagues at Georgia State who don't study gerontology, who make offhanded comments about aging or about older adults. Things that are as simple as, I don't know why you study that topic, it's so depressing. And I stop them and I say, no, you're making assumptions about what age is and about who our elders are. And it's not depressing. It's dynamic. And there's parts of it, like there's parts of everything that are sad, but there's also parts that are funny, and there's parts that are exciting, and there's parts that are dynamic. And so calling out ageism, whether it's in the community or in my friendship circle, I'm kind of known to be that person who's going to call you out if you say something that is inappropriate.
Aging is an opportunity. And if we can't look at it that way, then it does get depressing. But not everybody gets to do it.
Right, exactly. It's a privilege.
It is. And, the longer we're here, the more we understand about ourselves. And that's a great way to live.
I agree. The more trips we make around the sun, the more dynamic our lives are and the more opportunities we have to look at things in a different way and learn.
Absolutely. Well, Dr. Burgess, thank you so much for being with us today. It's always a pleasure to talk with you, and I look forward to talking with you soon.
Well, thank you. And I enjoyed this opportunity to talk to you. Like you said, I could keep talking for ages.
We'll get together and talk more. Thank you so much, Dr. Burgess, and thank you all for joining us at Let's Talk Aging. As you have time, please visit our website, secondwind.org, and have a look at the Dementia Interpreters Program. This is a program that we have through our partnership with Training to Care, our UK partner, and it is a translation program helping us to better understand the communications and the communication styles of people living with dementia. It is also linked with the Dementia Dictionary. This is a translation dictionary so that we can look at behaviors and complications that family caregivers, professional caregivers may post, provide guided translations, and crowdsourcing through our dementia interpreters of what that might mean. I look forward to talking with you soon. Have a great day.